If your feet burn at night and you've been told neuropathy is just progressive, this is for you. This is not for people looking to manage symptoms, but this is for people who want to understand why it's happening. Give me the next few minutes, and I'll explain why neuropathy pain feels worse at night and what most doctors never explain about calming irritated nerves naturally. If you want it broken down clearly, I created a simple nighttime nerve calm protocol that walks through this step by step so you can start protecting your sleep immediately. I'm Dr. Lisa Gregory, and at Pain Free Lexington, we specialize in structured neuropathy reversal programs that focus on restoring nerve function, not just suppressing symptoms. In every video, I'll give you one thing that helps you feel more in control of your healing. Many neuropathy patients notice something frustrating. During the day, symptoms are manageable, but at night, the burning, the tingling, the electric sensations, the 1 to 3 a.m. wake ups, it feels like your nerves come alive at the worst possible time. Most people take more medication before bed, rub creams on their feet, try to distract themselves, or just lie there hoping it passes. And when it doesn't, they start thinking, what if this is just getting worse? What if I waited too long? Because neuropathy flare ups at night aren't random. They happen for three predictable reasons. Inflammation naturally rises at night, cortisol drops, which removes your body's anti inflammatory buffer. When you lie still, irritated nerves become more noticeable. It's not that your nerves are dying faster at night, it's that the environment around them becomes more inflammatory and more sensitive. And no one explains that. Here's the structure we use inside our program to calm nighttime flare ups. Step 1, reduce evening inflammation. That means timing anti inflammatory strategies properly, not randomly. Step 2, downshift the nervous system before bed. Neuropathy patients often live in a low grade fight or flight state. If the nervous system isn't calm, nerves stay hypersensitive. Step 3, create consistency. Nerves crave rhythm. Irregular sleep timing and stress spikes make symptoms unpredictable, simple, structured, repeatable. Because nerves don't heal in chaos, they heal in stable environments. When inflammation drops, circulation improves, and the nervous system calms, irritated nerves stop firing so aggressively. Relief isn't random, it's physiological. If you'd like the exact structure we use, I put it into a simple nighttime nerve calm protocol guide. It walks you through how to protect your sleep without adding more medications. Because when you sleep better, inflammation drops, healing improves, nerve irritation decreases, fear reduces. And for many patients, the first breakthrough isn't less numbness, it's waking up and saying, my feet didn't wake me up last night. And that's where real hope starts.